Welcome back, friends. This is Nurse Eunice with Florida Training Academy, and in today's video, we're going to have trivia. That's right. We are reviewing 30 questions to help you pass your CNA and or your PCT examinations. And as we do in each of our videos, we're going to give you about 10 seconds so that you can receive your notifications. With that being said, grab a pen, grab something to write on, and grab a cup of water. Let's get ready to start our trivia. For my night owls, if you just want to chat, have some girl or some guy time, ask me questions. Tonight at 9 p.m. Eastern Standard Time, we're going to have our second episode of the night shift. It's just a way to, ask questions that you couldn't really answer during a Q&A segment or an exam prep tutorial. So join us on YouTube tonight at 9 p.m. Eastern Standard Time. Question number 1. You are assisting a resident who is blind with morning care. Which action is most appropriate? A. Complete all care yourself to save them the trouble. B. Ask what they want to wear and leave the resident to dress independently. C. Avoid talking so you don't distract them. Or D. Arrange personal care items in the same order every day and explain each step before doing it. Which action is the most appropriate when assisting a resident who is blind? If you chose D, you're absolutely correct. Consistency and clear verbal guidance support a blind resident's independence and safety. Explaining each step respects their need for orientation. Just leaving the items out without giving any explanation is not going to be assistive and it's not going to help them be independent. So you do want to provide consistent and clear guidance. Question 2. Now, this is a true or false statement. However, there are no true and false questions on your test, but this is just trivia, so true or false. A CNA can apply topical barrier creams as part of their duties. True or false? All right, revealing the correct response in 3, 2, and if you chose true, you are correct. So CNAs can apply topical barrier treatments that do not require specialized care, such as barrier cream for those areas where a patient may be irritated due to incontinence. However, if it includes medication, that would not be within the scope of the CNA's practice, and that would be applied by a nurse instead. Question 3. You have 4 patients who need help. Which would you see first? Is it A, Mrs. A wants her hair brushed? B, Mr. C wants water refilled? Is it C, Mr. B needs to go to the bathroom? Or is it D, Mrs. D needs help choosing clothes? All right, revealing the answer in 3, 2, and yes, it is C, because if a resident calls to go to the bathroom, that would be a priority. Safety and elimination needs take priority over comfort tasks like hair brushing or refilling water pitchers. Question 4, what is the medical term for a patient's inability to control their bladder? Is it incontinence, retention, urgency, or continence? All right, you should know this. Revealing the answer right now. If you chose A, incontinence, you are correct. So incontinence is the lack of control over urination or defecation. That is why your patient would have an incontinent pad or an incontinent brief in order to soak up that moisture. Question 5. Which of the following is a sign of a CVA? Is it A, foot pain, B, numbness and weakness from the waist down, C, slurred speech and weakness on one side of the body, or D, increased hunger? All right, do you know what a CVA is? And if you chose C, you absolutely do. A CVA, which is a cerebral vascular accident, is also referred to as a stroke. It often presents with weakness on one side of the body and slurred speech due to disrupted blood flow to the brain. That is a medical emergency. Get your nurse in that room right away. Question 6, true or false? Using hand sanitizer and wearing gloves are the most important methods to prevent the spread of infections. Is that true or false? I can't fool you. You know it is false. You know we have to wash our hands. And so while alcohol based hand sanitizers um, are a highly effective form of hand hygiene, and gloves serve as an important protective barrier when needed, neither, whether alone or combined, is as sufficient as just good old washing of the hands for 20 seconds with warm water and with soap. Wash those germs down the drain. Number 7, a resident with terminal cancer is spending most of the day sleeping and refusing most food. Family is upset that they are not eating. What is the most appropriate CNA action to promote comfort? Would it be A, wake the resident hourly to encourage meals? B, reassure the family that declining appetite and increased sleep are natural at the end of life and focus on comfort measures? C, push fluids and food aggressively to prevent malnutrition. Or D, insist the resident must eat at every meal. Remember, this patient has terminal cancer. So, what is the most appropriate CNA action? And that's right, it is B. We understand that declining intake and increased sleeping are normal at the end of life. While the family may not know that, CNAs must promote comfort care by providing emotional support and honoring the residents, not the family's wishes. And if you don't feel comfortable explaining that to the family member, maybe you should get your nurse in the room so that the family can be educated on the death process, because they may not know. They may have just traveled in from another state and now they see grandpa or grandma in a state in which they're not eating, they're not waking up, and that can be really, and it can take an emotional toll on family members. Question 8. Your residence care plan indicates check vitals Q4H and repeat if HR is that sign 100 or BP is another symbol 90/60. Which vital sign should you report? Okay, what I'm doing here is seeing if you understand your symbols. What does this mean? All right, and so would you report A, heart rate of 98, B, a heart rate of 64, C, a heart rate of 110, or D, a blood pressure of 128/78? So, what do these symbols and abbreviations mean? I'll give you 10 seconds on this one because it's a little bit tricky. All right, we're doing vital signs Q4H, and then HR with a symbol 100, or BP with another symbol 90/60. All right, that means something. And if you chose C, you understood that the care plan said that we have to do vital signs Q4H or every 4 hours, and that if that heart rate was greater than 100 or that BP was less than 90/60, you were supposed to notify your nurse. So the heart rate of 110 is greater than 100 and therefore must be reported. The other vital signs, heart rate 98, heart rate 64, or blood pressure of 128/78, are within the normal specified parameters and do not require immediate reporting. You'll still document it, but you don't have to let the nurse know if your patient is stable and doing well. Question 9. The CNA's role in care plan meetings is to A, develop the care plan, B, transcribe the meeting notes, C, order diagnostic test, D, carry out the care plan. It says implement, but it should be carry out the care plan, and report observations. What is the CNA's role in care plan meetings? All right, revealing the answer in 3, 2, and that is right. It is D. CNAs contribute observations and they help carry out the care plan. So the nurse initiates it and then you follow to make sure that the patient's receiving the care as prescribed by their provider. Question 10, true or false? This one's about diet management. Residents on a 2-gram sodium diet can have processed foods like bacon and canned soup. Is that true or false? All right, so what is a 2-gram sodium diet? It is a specialized diet for those who have cardiac disease, and so they cannot have a lot of sodium, so this would be false. Processed foods like bacon and canned soup are often high in sodium. Residents on a low sodium or a sodium restriction, such as 2 grams, must avoid these foods to manage conditions like hypertension and heart failure. Number 11, and remember, we're going all the way to 30. Your resident is diabetic. What would you report immediately? Is it A, the resident wants to go to the activity room? B, the resident is watching TV? C, the blood sugar is 52 milligrams per deciliter? Or D, the blood sugar is 102 milligrams per deciliter? All right, we'll give you 5 seconds. 4, 3, 2, and that's right, team. It is C. Give yourself applause. Rationale, blood sugar of 52 is very low and is considered an emergency. So you get the nurse in the room. Normal fasting blood sugar levels, if they haven't had food, let's say they went to sleep, they wake up in the morning, blood sugars of 70 to 99, that's acceptable. If the person has eaten, then we will say a blood sugar of less than 140 is acceptable. And so if a person's blood sugar is 102, that's actually fair. That's pretty normal. So, however, the one of 52 is the one that's going to require the nurse come in and actually assess that patient, and the nurse will determine whether or not that person can have orange juice or something that is sugary, or if they need something intravenously, such as dextrose. Excuse me. Question 12. Which of the following is a normal adult respiratory rate? Is it A, 12 to 20 breaths per minute, B, 10 to 12 breaths per minute, C, 4 to 8 breaths per minute, or D, 22 to 28 breaths per minute? Do you know your vital signs? All right. 3, 2, and yes, it is A. So adult respiration range is normally between 12 to 20 breaths per minute. And so if you are going to be somebody who wants to care for kids, if you want to work at a pediatric hospital, you have to, once you pass your CNA test, go back and study those pediatric vital signs and the reason that a child or an infant would be hospitalized, because you want to make sure that you know that before you interview, because they could be asking you questions like this during the interview, or you may have to take a test whenever it's part of your application process. Question 13. You are helping a resident with range of motion exercises. What is the correct action for abduction of the resident's arm? Is it A, moving the arm toward the center of the body, B, moving the arm away from the center of the body, C, bending the arm at the elbow, or D, rotating the arm in a circle? Which of these would be the correct action for abduction of the resident's arm? And when we abduct something, we take it away. So it is going to be B, everybody. Abduction means moving a body part away from the midline of the body. Moving the resident's arm outward is an example of abduction. And the opposite, adduction, would be when you bring the arm back towards the body. Number 14, when repositioning a resident who is at risk for pressure ulcers, why is it important to pad areas like heels and elbows? Is it A, they have strong muscles and need less padding? B, these are areas where skin rubs together. C, these are bony prominences where the skin is at greater risk of breakdown. Or D, these areas rarely come into contact with the bed. Heels and elbows, why are they sometimes padded? That's right. That's right. That's right. You chose C. You have it. They're not rubbing together. Your elbows don't rub together. Your heels don't rub together, but it does rub against that bed. So a bony prominence is an area where bone is close to the skin surface. It rubs against bedding, or it can be sheared. So a bony prominence is an area such as a heel and elbow or sacrum, these spots are at high risk of pressure injuries due to friction and pressure. Number 15, your resident takes a diuretic every morning. What would you monitor as part of their care? A, watch for signs of dehydration and increased urinary output. B, avoid helping them to the bathroom to encourage independence. C, do not report an increased need to urinate. Or D, give them extra salt with their meals. So this question requires you to know a category of medications. What is a diuretic? And how does that relate to your care as a CNA? Yes, it is A. So a diuretic actually increases urination. And so it helps to remove extra fluid. And so CNAs must monitor for fluid balance changes, dehydration, and increased toileting needs. That's right. Usually your patients will get diuretics in the morning and in the evening. And so when they call to go to the restroom, if they've had a diuretic, not only do they have to, usually urinate often or frequently the first few hours after the medication's been administered, they also have urgency. They have to get up. And if you don't get to that room quickly, your patient's going to more than likely have an episode of incontinence. So if your patient takes a diuretic, move faster, have maybe a bedside commode there, and you must have some type of urine collection device because we have to monitor their output. If you haven't liked our videos, shared our channel, or subscribed, this is a great time to do so. We're almost at 1 million subscribers, and you can help us meet our goal. Question 16. If a resident with dementia is at risk for elopement, what is the most appropriate CNA action? A, ignore the care plan interventions. B, encourage them to wander outside as long as they return by dinner. C, assume they will not try to leave again. Or D, monitor and supervise the resident closely to prevent them from leaving the facility. So your residents who are at risk of at risk of elopement are oftentimes in a secure area because they have to be monitored. The answer is D. Elopement means a resident wanders or leaves a safe environment unsupervised. CNAs must closely supervise and monitor to ensure their safety. Number 17, a resident's care plan states that they are partial weight bearing. What does this mean for ambulation? A, the resident cannot put any weight on the affected leg. B, the resident can put some weight on the affected leg. C, the resident must remain on bed rest. Or D, the resident can bear full weight on both legs. All right, and so you must be on an orthopedic unit today. Your patient possibly had a surgery that involved a large joint. And so whenever you see something that says partial weight bearing, that means that the patient B, partial weight bearing means that the resident is allowed to put some weight on the affected leg. And so, but not full weight. So maybe they can do like a toe touch. 18, true or false? ROM exercises can help prevent contractures. What does ROM stand for? Put it in the chat. All right, that's right. ROM stands for range of motion. So let me repeat this. ROM, or range of motion exercises, can help prevent contractures. Is that true or false? It's true, team. If you don't move it, you lose it. That joint is going to get stiff. And so range of motion exercises help to prevent stiffness and the loss of mobility. Whenever a joint is fixated, that's when we refer to it as being contracted. So the way that you're going to prevent a contracture is by providing, if the patient's unable to do it and you're doing it on their behalf, that is passive range of motion. If the patient can move their arm or their joints when you instruct him to do so, that would be active range of motion. 19. What is the correct method for log rolling a resident? Is it A, rolling them in short, jerky motions? B, twisting the shoulders before moving the legs? C, rolling them one part at a time? Or D, moving the resident as one unit to keep the spine aligned? Okay, so we would typically log roll a patient after spinal surgery, or maybe if we suspect some type of spinal injury, we would log roll the resident or the patient. All right, revealing the answer in 3, 2, and it is D. Log rolling is moving the resident as one whole unit. So one person has hands on the shoulders, another may have their hands on the hips, while another has their hands on the legs. So it may take a few more caregivers than normal, but we have to keep that spine aligned. And so again, this is often something that's done after a spinal injury or surgery. Number 20, a resident with dementia who's at risk for elopement must be carefully monitored because A, they may attempt to leave the facility without supervision. B, they require pureed food due to dysphagia. C, they may need partial weight bearing during ambulation. Or D, they may need assistance cleaning dentures. And this one's easy because we just had a question similar to this one. So 20 is A. Elopement means a resident wanders or tries to leave a safe area, and so you must monitor them carefully. 21. Which action is most appropriate when providing denture care? Is it A, wrap dentures in a napkin so they don't get lost? B, rinse dentures with hot water to kill germs? C, store dentures in a labeled denture cup with cool or lukewarm water overnight? Or D, boil dentures weekly to keep them clean? And as a reminder, if you hearing me read the questions and the answer options to you, if that's helping you to understand the content better, don't forget that when you take your CNA examination, you can request an audio test. That is right. Look, I just need you passing your test. There is no shame if you need an audio headpiece. I want you passing your test on the first attempt. And so use the resources that are available to you. And normally an audio test does not cost any more money than a regular CNA examination. All right, so question 21, team. The answer is C. So denture care requires gentle handling, so we're not boiling dentures or putting them in very hot water because that can reshape the dentures. And so you're going to use cool or lukewarm water to store your dentures safely, and they should be kept in that labeled denture cup so they don't dry out, they don't get lost, and or they don't warp. Number 22, a resident is on a pureed diet. What are they most likely to receive? Is it A, foods chopped into small pieces, B, foods blended into a smooth pudding-like consistency, C, foods with thickened liquids only, or D, foods that require a fork and knife? So if when you think about pureed foods, you think about something that's the consistency of baby food, you're right, it's B. So a pureed diet contains food that is blended into a smooth texture to prevent choking and ease swallowing. 23. You find a resident who has slipped and fallen on the floor. What is your most appropriate action while waiting for the nurse? Is it A, help them stand up right away to check for injuries? B, assess for injuries and help them off the floor? C, ignore the resident and continue working? Or D, keep the resident still and reassure them until help arrives? All right, a resident who's on the floor, what does the CNA do? If you chose D, you understand that you do not get that patient up. You have to keep them on the floor. When the nurse comes, they'll work as a team. We'll call other people to assist to get them off the floor. So keep the resident still and reassure them to prevent further injury. Never move a fallen resident until they have been properly assessed by the nurse. If you're in home care, that means you may have to call 911 because the paramedics, the EMT, they may need to come to assess that patient. So you would, of course, have protocols already established from your agency. But in that case, you would not be waiting for your nurse to come. You'd instead be waiting for EMT to evaluate the patient. 24, you discover a resident having a seizure. What is your most important action while waiting for the nurse? A, place a spoon in the resident's mouth to prevent biting. B, restrain their arms so they don't injure themselves. C, protect their head with a pillow and move away furniture. D, give them water as soon as the seizure stops. When a resident is having a seizure, it's very important for you to protect their head. So it is C. During the seizure, protect the resident from injury by moving surrounding furniture and placing something soft under their head. You don't try to hold them. The seizure needs to take its course. They may be thrashing about, so try to protect them from injury. Do not restrain them. Don't put anything in their mouth. And after the seizure, they're usually incoherent, and so you're not going to give them water immediately after a seizure. They need to be evaluated first to make sure that they can swallow safely. What you do instead is you'll turn them to their side to protect their airway. 25. Which is a sign of dehydration? Is it A, moist skin, B, frequent urination, C, dry mouth and dark urine, or D, warm hands and feet? What is a sign of dehydration? All right. A sign of dehydration would be dry mouth, dark urine. The other one, frequent urination, that's not a sign of dehydration. If someone is deficient of bodily fluids, they're not going to have a lot of urine produced. And so whenever you see scant amount of urine, dark urine, urine that has a foul smell, that would be signs of dehydration. If the patient can tolerate it, of course, you're going to encourage increased fluids, but you're also going to notify your nurse because maybe they can start an IV and replace their fluid intravenously. True or false, number 28. The CNA can adjust the resident's oxygen flow rate if instructed. So the nurse tells you to turn the oxygen up to 4 liters per minute. Is there something that you can do? True or false? False. CNAs cannot adjust oxygen. Think of oxygen as a drug. It's actually prescribed by a doctor. CNAs do not give medication, so therefore you cannot give oxygen. What you can do is you can troubleshoot. If the tubing becomes disconnected from the actual device, you can reconnect it, but you cannot change the flow rate. If there's a reason that the patient's flow rate needs to be changed, the nurse needs to do it, and or the nurse needs to call the respiratory therapist into the room in order to do so. Question 27. Your resident's blood pressure is 130/80. What is this considered? Is this A, hypotension, B, normal blood pressure, C, hypertension, or D, bradycardia? Right. A blood pressure of 130/80 is considered normal. It is B. Even though this falls into the high normal range, it is still considered within the acceptable range for most adults. So hypotension is when the pressures are usually less than 90. Systolic would be less than 90, and then the diastolic would be less than 60. And then hypertension is when the systolic is greater than 140 or the diastolic is greater than 90. So a patient could be marginal. They can be on the higher end of the normal range, and you would continue to monitor them. Number 28, you check the vital signs of a resident and obtain the following. The blood pressure is 85/52. The heart rate is 110 beats per minute. The respiratory rate is 24 breaths per minute. The temperature is 98.4. The resident is dizzy and complains of weakness. What is the most important CNA action? A, reposition a resident to sitting and encourage them to drink water. B, report these findings immediately to the nurse and help the resident lie flat with legs elevated. C, give the resident extra blankets to raise their temperature. Or D, check vital signs again in 1 hour. All right, and these questions are designed to get you thinking. All right, revealing the answer in 3, 2, and that is right. If your patient's dizzy with a low blood pressure and a high heart rate, get them back in that bed. You can elevate their legs a little because a blood pressure of, I think it was 90/60, and that heart rate indicate hypotension and possibly shock. Something's going on with your patient. So promptly report it to the nurse. Again, place the resident. I wouldn't necessarily place them flat, but I would get them back in that bed because they could have other conditions, such as shortness of breath. So, but do get them back in the bed, elevate the legs, and then let the nurse determine in this particular instance if it's okay to have that patient flat because their respiratory rate was 24. I know that's a lot for you to figure out. That's why you don't have to figure it out. Just get them back in the bed, keep them safe, and you notify your nurse because some things are just above your level of knowledge as a CNA, and that's okay. Question 29. What is one reason a resident may have a low appetite? Is it A, asthma, B, increased energy, C, too much socializing, or D, depression? Why would a resident not feel like eating? That's right, it is D. Depression often decreases appetite, so they're not going to eat. What do you do as a CNA? Pretty much every time you go into that room, you're going to be offering them something light. Would you like some applesauce? Would you like your boost? Can I give you some water? Because if they're not eating, they're probably also not drinking. So dehydration and decreased appetite usually go hand in hand. Question 30. You measure a resident's pulse at 48 beats per minute. What is this considered? Is it tachycardia, bradycardia, normal pulse, or hypertension? Yep, you got it right. A heart rate that is less than 60 beats per minute is considered bradycardia. And so the normal resting heart rate for an adult is 60 to 100 beats per minute. So anything less than 60 is bradycardia, and it must be reported and documented. Don't forget to document these vital signs, whether normal or abnormal. And then if you need some content, let's say that you need an ebook, you need a study guide. Look, I have got you. If you go to nurseeunice.com, you can see our downloadables. And if you're interested in taking a CNA class, a CPR class, if you want to be a CPR instructor, don't forget to go to our website, which is fltraining.com. We're located in Jacksonville, Florida, but we are worth the drive and or the flight. For those of you all who are interested in going further with your CNA, don't forget that the next step before nursing would be PCT. And yes, we offer hybrid patient care tech courses through our partnership with CareerStep. And so for U.S. students only, because we have to place you, we have to give you a clinical site, and we can't do that for our international students. So for U.S. students only, I want you to call 877-225-7151 and inquire about our online patient care technician programs. That in that program, you're going to learn phlebotomy, EKG, and at the end, you'll sit for your national certification examination so that you would become a certified patient care technician. So again, that is 877-225-7151, or you can go to floridacareeracademy.com. As we say in each of our videos, we want to remind you that caring CNAs make caring nurses. That's right. You're following the right path. You're on the right track. And so just keep doing what you're doing. Have faith in yourself. You can do it. You can pass your CNA test. You can become a PCT. You can enter nursing school. And we are here to guide you. So team, I love you. I pray that you have a blessed day. And don't forget, tonight at 9 p.m., join me for Night Shift with Nurse Eunice. We're just going to giggle, maybe drink some coffee. We probably don't need any at night. But anyway, we're going to drink some coffee. Let's do some Q&A, and let's get to know one another. So I hope you enjoyed this trivia. Don't forget to like, share, and subscribe. Have a great day, everybody. Bye.